Welcome to This Explainer. Today, we are diving straight into a massive breakthrough in oral surgery. Look, if you're placing dental implants, you know the absolute anxiety of unpredictable healing. Well, what if we could take that anxiety totally out of the equation? We're talking about a completely novel way to achieve truly predictable implant success. And it's all thanks to PEMF. That is PEMF, Pulsed Electromagnetic Fields. We are looking at a brand new 2025 paper right out of Nature's NPJ Biofilms and Microbiomes. And this isn't just some abstract theory. It takes aim at literally the highest stakes problem in oral surgery right now. I'm talking about dental implant-related infections. You know the stats. Conditions like periimplantitis affect up to 45% of patients. 45%. It causes progressive bone loss, and frankly, right now, we just don't have effective FDA-approved therapeutic strategies to stop it once it starts. It is literally the primary cause of implant treatment failure. So, the million-dollar question here is, how can we make implant success more predictable? Like, how do we finally move past the nightmare of unpredictable failures, patient discomfort, and compromised bone? We absolutely need a way to build a real, rock-solid foundation for reliable, evidence-based preventative dental care. And we need to do it right from the exact moment that implant is placed. To figure that out, the researchers got creative. They tested a miniaturized PEMF device acting as a healing abutment to see if it could actually modulate the microbial environment around the implant. And their methodology was fantastic. They took this from the lab straight into the human mouth in 2 phases. Phase 1, that was an in vitro polymicrobial model. They used actual human saliva to grow these complex biofilms on the devices in the lab, evaluating them at 24 and 72 hours. Then, Phase 2 took it in vivo. They literally had 5 healthy human volunteers wear palatal appliances containing both activated and non-activated devices in their own mouths for 3 straight days. That simulates real, highly challenging clinical conditions. Okay, let's get into the results, because this is where it gets crazy. 10. Just think about that number. Early on, at the 24-hour mark, both the active and control devices looked pretty similar. But at the critical 72-hour mark, that is the late stage of biofilm formation, right when microbes usually trigger a massive inflammatory response, well, the activated PEMF device resulted in a 1 log reduction. To put that in plain English, the microbial count was exactly 10 times lower than the non-activated control group. 10 times. And the researchers didn't stop there. They used high-throughput 16S RNA sequencing to map out the entire bacterial microbiome. When you look at the data, the activated PEMF pulse group didn't just see some generic drop in bacteria. They saw a staggering 5-fold or even greater decrease across 23 specific bacterial species. We are talking about notorious red complex pathogens here: Porphyromonas gingivalis, Treponema sucrensosci, and Tannarella forsythia. These are the highly destructive, tissue-damaging bad guys most responsible for periimplantitis and bone loss. And their presence? It just absolutely plummeted. Now, this brings us to the ultimate so what factor of the whole study. This PEMF technology doesn't just blindly nuke everything in the oral cavity. It fundamentally modulates the microbiome dynamics. It's like a smart system. While the control group stayed completely dominated by disease-causing species like Prevotella and Porphyromonas, the PEMF group showed a total absence of major pathogens. But here's the best part: it actively preserved the health-associated actinomyces species. It's essentially taking a diseased, highly inflammatory environment and shifting it completely toward a healthy, balanced profile. So, what does this actually mean for you, the clinician, in your daily practice? Let's break down the major clinical takeaways. First up, this technology delivers exactly what every oral surgeon wants: highly predictable implant success and tissue regeneration. Second, it fosters top-tier evidence-based preventative dental care by basically stopping the infection before it even establishes a stronghold. Third, the study showed the PEMF activation actually enhanced vital salivary protein adsorption, which is incredible for healing, and it did this without altering the physical or chemical surface properties of the implant itself. And finally, because it operates at a low frequency, it safely manages that biofilm progression without generating any dangerous heat that could damage the surrounding tissues. This is quite literally the future of predictable implantology. You really need to see this technology in action to truly appreciate its potential for your patients. So follow Magdent on Instagram and LinkedIn at Magdent MED, and visit magdentmed.com to book a demo. That's MED. Again, MED. Go follow them, get your demo booked, and start making your implant success incredibly predictable. Just think about it. If we can successfully reprogram the microbiome to accept an implant without any drugs or harsh chemicals, what other systemic dental issues could PEMF solve next? The possibilities are endless. Thank you so much for joining me for this explainer, and I will catch you next time.